All right, so good afternoon, everyone. I'm Timnit Berhane, and on behalf of the Community Engagement Core at the Institute for Health Equity Research at Mount Sinai, I'm so happy to welcome you back into the Advancing Health Equity Together, a community engaged research seminar series. Thank you to everyone who participated in our 2024 series. We truly appreciated all of your great feedback, and we've tried to incorporate them as much as possible into our sessions for this year. So I hope we all hope that you'll find the sessions and topics informative and helpful. For anyone joining us for the first time today, we're so happy you're here. This is really meant to be a space to learn the basics on community engaged research, learn from experts on their practices and methodologies, and think through how you may be able to incorporate them into your own research and work. Um, Today's topics is on establishing community advisory and action board. We're going to start with a great panel conversation, and then we're going to reserve the last 15 minutes to just take for the Q&A. So if you have any questions come up during the session, please feel free to drop them in the chat. But we're also gonna have that final 15 minutes where you can just come off mute and just ask your questions. So our panel today, which we're so happy to have, Dr. Nita Vangipuram is an associate professor in the departments of pediatrics and population health science and policy, and is associate director of the community engagement core of the Institute for Health Equity Research at Mount Sinai. Second, we have Crispin Goitia, who's the engagement program manager for the Institute for Health Equity Research and the principal investigator for the Insight Data Network with over 20 years of experience in engagement. Last but not least, we have Brenda Lee Rodriguez, who's a senior engagement officer at PCORI, providing guidance on patient and stakeholder engagement in comparative effectiveness research. Previously, she directed the Chula Vista Community Collaborative and led community health initiatives at the University of Miami. With over 25 years of experience, she's worked on community-based interventions addressing health disparities in the US and Australia. We're so happy to just learn from all of you today. And Brenda, it's such an honor to have you here, and thank you so much for joining us. And I'm just going to pass it to you now to just give us more insight into what PCORI is and all of the great work that's happening there. And I'm going to switch to your slides now.
Thank you so much and welcome everybody. Again, my name is Brenda Lee Rodriguez, and before we go in, I wanted really to let you know what the perspective that I bring from the Patient-Centered Outcomes Research Institute headquarters in DC. And because what we will be discussing today in terms of the putting together CAPS, and we wanted to frame it on in my segment regarding research. Next slide. So PCORI, for short, of the Patient-Centered Outcomes Research Institute, is a non-for-profit, independent research organization. And we want to assist patients and or caregivers and to be empowered to make their decisions about their health and healthcare choices. We fund comparative effectiveness research, which basically compares two or more medical treatments or services or health practices. And the findings from these studies will help patients and other partners. And the vast majority of the research funds go to those studies, comparative effectiveness, but we also fund research support projects. And on all of those, including dissemination and implementation, we urge engagement of patients through CAPS, through advisory groups. And that's where the perspective that I'm bringing to you today. Next slide. So basically, we fund and we incorporate in our engagement activities different stakeholders and collaborators throughout the studies. Next slide. And that's how we claim that we are doing research differently and in aiming to produce that evidence base. Next slide. We are doing engagement and we are telling our awardees to conduct engagement activities with those advisory groups throughout the life cycle of the study, from the beginning all the way to the end in dissemination and in future implementation of those studies. And not to fret, you're going to get all these slides later after the presentation ends, because there are many links that I would like you to have and explore on your own. Next slide. So our community advisory boards in our studies, it help and set up the studies all the way from the planning phase, proposal writing, and once they are awarded the contract, then conducting the study and disseminating the study results. Next slide. We do aim that those partners, patients, caregivers, and other stakeholders can be involved in every step so they can influence later on the adoption of the study results in these pragmatic trials. Next slide. And we have many resources on the website. So this is just one of the many, and that's the guidance we provide on the foundational expectations for these partnerships with these advisory panelists and in groups, advisory committees, however you want to call them. And we have those expectations delineated. We have resources that you can put into practice right away. And we even have case studies for you to explore further. Next slide. And you can stay connected with us. In this PDF that you will be receiving, there are many links that you can explore further about PCORI. But certainly it's an honor to be here and talking to you. And let's get at it right away. Thank you, Timmy, for the slide.
Thank you so much, Brenda-Lee. And we'll make sure to share the slides and your contact information for anyone who's interested in connecting further. All right, you can see my slides again. Okay, so now to just go straight into our conversation for today, Dr. Bangipuram, if you want to kick us off and just help us understand why is it even important to establish boards?
Okay, can you hear me?
Yes.
Okay, great. So thanks everyone so much. It looks like a lot of people did end up trickling in. So really excited to talk about this topic. And thank you, Brenda-Lee, for your presentation, all the wonderful resources that PCORI offers to support engaged research. And so we wanted to kick this off by talking about why should researchers even think about convening a community advisory or community action board to support their research. There's a few key things we wanted to point out here. One is that boards provide a structure for a way to amplify community voice. So we can ensure that the research that we do reflects the needs and priorities of the communities that we're trying to impact. It also allows for a mechanism for moving forward community efforts and helping to drive change through advocacy, partnerships, and local engagement efforts. And finally, it allows us to bring together people from different disciplines and sectors to really pull together a network between community members, researchers, policymakers, community-based organizations, so that we can all come together, bring our expertise, figure out how to allocate resources, and hopefully come up with innovative research and solutions that will really drive change. Next slide, please. So just as we're starting to think about putting together a board, what are some of the things we would recommend considering during the early stages of planning projects and bringing together coalitions of people? First is we want to utilize our existing community networks and organizations so that we can really try to reach a broad range of potential members. This sort of relates to the idea of really coming up with a recruitment strategy that will allow diverse voices into the research process so that you get a mix of perspectives from different people based on different demographic backgrounds, different lived experience, different expertise. And part of the process is to really early on, um, speak with these diverse groups and representatives of diverse people to really identify community needs with these representatives so that the research that we plan addresses those needs and that the data and results that we achieve will help inform change to meet those community needs. And early on, it is also really important to come up with a really clear and transparent process for how we identify and vet potential board members, nominate them, and really making clear the expectations and commitments of the board members so that people are informed when committing to being part of the group.
And
Thank
Chris, yeah,
Thank
I was gonna pass
yeah.
it to you.
No, I'm here. Thank you. And so next we'll talk about board formation and structure, which is really an important component of when you're thinking about convening boards and bringing them together. And so it gives you the opportunity to really provide some comprehensive training for new members to understand the research process, ethical considerations, and their roles in their community boards, whether it be an advisory board or an action board. And the training piece is so key because you're bringing in people from different perspectives and lived experiences and other types of experience, and really want to make sure that people have the opportunity to kind of start off with the same information. Why are we here? Why is this important? And what do I need to know to really contribute? And helps to find defining of responsibilities of CABs and people involved in them include providing feedback on research design, recruitment strategies, data analysis, and dissemination of findings. So as Brenda Lee mentioned before, kind of that whole lifespan. So from the beginning all the way through the end of the project and taking that into the next phase of whatever that will be. And then thinking about considering leadership structure, right? Elect a chair and other leadership positions within the CAB to facilitate these conversations and discussions to really decide how decisions are going to be made. That's super important. We suggest that you elect the chair only because we want there to be some sort of structure, but there are some where that's not necessary. And as a group, you'll all decide together what's the best fit for you all. And really a big note that capacity building efforts are always bi-directional, and all steps are a joint effort together for community members and research team members and other external partners to really come together and work together to participate in all of this and make these boards really, really great things. Next slide. And here we have ongoing engagement and collaboration. So meetings with structured agendas to discuss research progress, really think about what the concerns and some challenges might be, and an opportunity to provide really critical input and make decisions, which is why the slide before is so instrumental, because once you have your formation and structure down packed, it really leads you into the next piece, which is how do we get into the business and roll up our sleeves and get the work done and make these decisions? And then open communication, transparency, transparency, transparency is super important. We think of that in our own personal lives and in our professional lives, and the work that we do outside of them really is super important. And for researchers and CAB members to really be able to build trust, understand each other's needs is super important, and open communication is key in providing this. And then when we think about bi-directional capacity building, we want everyone to learn from one another, right? So it's really important that we provide opportunities for our CAB members to learn about research teams, skills, develop what they need to know, train people up to participate actively, learn to ask questions. And every question is a good question, regardless of what a person may think or their perspective, right? And also on the other side with the bidirectionality we talked about is helping research teams to develop their skills in engaging with communities and communication skills and knowledge related to the communities and populations they'll be working with and engaging with.
Thank you so much, Crispin. Yes, the bidirectionality factor is very important. And
Absolutely.
yeah, randomly, I know in our like conversations we talked about a lot about like meaningful community compensation and evaluation processes. So if you can please expand more on it based on your like experiences in your different roles.
Definitely, yes. As Crispin was indicating, related the ongoing relationship from the beginning, and I do want to emphasize that projects should dedicate explicitly in their plans and in their budget and budget justifications funds to support this engagement activities with partners, compensate the partners for their time, expertise, and their perspective in a timely manner and in ways that reflect their preferences and roles. This it should be expected that it's not just on a volunteer basis and with, in case that they're volunteers, but very clear, again, transparency. But certainly the best ideal scenario is to plan ahead and dedicate the funds for that compensation in financial and non-financial ways. We have had some chats about like, oh, what about providing childcare, or providing a tab, an iPad for work. But those are basically enablers for participation, and those enablers, like Wi-Fi, the tablet, the parking, or the Metro card, those should be classified as rather enablers and not substitute for actual financial compensation. That's important in building those relationships and trustworthy and environment. There are questions that your team needs to sort out to find the appropriate amount or appropriate agreement for that compensation to happen. Regarding, at the beginning, you can get started with questions regarding, oh, to what extent does the budget will compensate the first few years, the whole cycle, and why to bring to the table other partners that can support with this financial aspect of it. To what extent compensation amount covers the out-of-pocket costs that may be barriers for, as I was saying, barriers to participation, such as the parking, transportation, and healthcare. Those are separate from the actual compensation. And also to take care of other related expenses of this engagement, like interpreters, the technical software needed to include those translation services or captions to enable that participation. And you need to also, as a team, in this transparent environment, plan for timely compensation. Sometimes there are organizational barriers that delay the process, and the individuals, do their work and are expected to be paid, but there are sometimes those organizations are like filling out forms and showing up insurance and vendorizing and all those processes that if you plan ahead, you may be able to remove or facilitate or expedite some of that paperwork that may be a barrier for timely compensation. And the next slide. I think that with that part, also comes that evaluation. How did we do? How are we doing? Not really to wait until the end to rather take a temperature check and being able to learn about the processes and see if changes are needed in the way that you are eliciting the feedback from this community advisory board or steering committees, or however you want to call them. And then also how to process that feedback, and how do you manage conflicting feedback, because you may also get that, and you have to, as a team, resolve discrepancies, and also how to integrate and decide what to incorporate from all the feedback that you gather, and reporting back to those that you ask the questions in the first place. That helps with sustainability. That's why those feedback loops are important in both quantitative and qualitative ways. So it's a good combination that works for that team. That way you sustain and maintain and enhance those relationships as you work with them throughout time, through the life cycle of projects. That this is the expectation that you have to involve members of the team, that continuous learning that Christian was talking about earlier, but it's specifically on the process of engagement, right? On the being able to understand whether the engagement activities is occurring as intended, and if so, and if it's not the case, then what modifications can be made live, and not waiting until the end of the project. Next slide.
Thank you, Brenda. Those are all very important points. Dr. Vangipuram, if you have any other considerations you'd like to share with us.
Yeah, so I think, coming full circle on all the things that we've been talking about, some of the key tenets of community engaged research and working with boards. First is thinking about the power dynamics. So really creating a space that empowers people and ensures that the members really feel like they're treated as equal partners in the process. And one of the ways, and that they have a genuine influence on the decisions, so that, if you're having a conversation and discussing an idea for a survey, for a data collection instrument or a recruitment strategy, or how you're going to disseminate findings, that that there's a process, a decision-making process, and that the group is really involved every step of the way and can see the translation of those decisions into the actual activities that the research takes part in. So, not just sort of putting a rubber stamp on things that the research team decides upfront, but really having meaningful conversations and having the board really be able to see that the decisions that they make are being translated into reality on the ground in doing the research. It's really important, obviously, to respect diverse cultural backgrounds and practices when engaging with community members. And, always invite open dialogue in terms of making sure that different diverse voices, in whichever ways people identify, it's not necessarily just about racial and ethnic cultural sensitivity, but around any ways, in the intersectional ways that people identify, and making sure that everyone feels heard and represented. And then it's always very important, and Brenda Lee kind of referenced this, but really in the sort of processes of getting feedback and completing those feedback loops, anticipating and coming up with strategies for addressing conflicts or disagreements. So when you create an open dialogue in a safe space, you have to expect that not everybody's going to come to consensus on everything, but people should think in advance. What are the strategies we're going to use to address these conflicts or resolve them in a way that feels equitable and fair to everybody involved, and then that things are constructive. We want to try to create spaces where disagreement doesn't lead to contention or ill feelings, but really figure out a way that everybody's voice can be heard, and that we can sort of figure out ways to resolve the conflicts. And it's not always comfortable, and sort of level setting with the board that there may be times where things get a little heated, and really setting those expectations in advance, but also ensuring the group that they will collectively come up with a way to resolve those conflicts. Next slide. And then finally, this is just some resources that our group has put together. And again, we'll be sharing these slides with everybody who's registered for the session. So you can be on the lookout for those. And I think now we're gonna open up with some questions.
Yes, that was really insightful. Thank you so much. There's always like so many great points. I was thinking of like the reporting back nature and, like making sure that like the importance of bidirectionality, whether in trainings or, like throughout all of the other steps of the process, and like welcoming transparency and open dialogue. And Brenda, I loved how you differentiated between enablers versus compensating, because enablers are really just there to make sure that people are even like able to do the work in the first place. Um, and what I wanted to ask is, and to everyone really, is if you can share with us some like examples of advisory or action boards you've been part of or helped establish.
Well, I can briefly get the ball rolling there with um, all the research projects and other types of research support projects that we fund. We require them now to address the foundational expectations, what we expect for them to integrate and plan ahead. So for awardees, for those that are already awarded, we kind of are not requiring them, but we strongly encourage because those contracts were awarded already. So if you can access the link that I put on the chat about those foundational expectations, it kind of breaks it down as all the topics we covered today, and it has links to examples, because we have a literature explorer that teams agree to share their resources as examples that you can take a look, and practices that have been found effective is to put all those roles and expectations for those members in a memoranda of understanding in a document. Doesn't have to be very legalese, but certainly a document that in plain language can explain what is expected of those members that you intend to bring in, that you're inviting to bring in, so they have recourse to go back and if need be along the way, those documents can be revised, because upon the practice, there's always something new to be found. So those community members or advisory members, either coming patients, caregivers, or other stakeholders that you bring to the table, once they accept to join, they sign that agreement, that contract. So my agreements I've seen, it includes like very specific, like it's gonna meet on a monthly basis for 1 hour, and if you're expected to prepare. But others are more like with more open language. And again, that doesn't have to continue like that. After some implementations you get under their belt, that experience, you can modify those agreements and reassess their commitment, their availability, and interest. And those are examples of very concrete tools that you can see in our website, as well as other links that you can see in the chat.
Thank you so much, Brenda Lee. This has been an amazing panel, and I appreciate all of your insights so much. And I'm really excited to see that the chat has been popping off with some other questions, and we'll be getting to those in a moment. We just have a few questions for each of you. And I will start with asking Dr. Vangiparam a question about early career investigators. And say you have an early career investigator who really knows that there's value in having community partnerships, wants to be doing community engaged research. What pearls of wisdom do you have for them in terms of beginning to build those relationships with community partners?
Yeah, this is a really common question that I feel like we get from people who are, a little bit newer into doing community engaged research and sort of where do I even begin? I think my best piece of advice there would be start early. So be in the communities that you're trying to work with before there's anything, even a question about research, right? So the worst thing that you can do is to kind of cold contact somebody out in the community and say, I'm doing this project. This is what I'm going to study. Can you help me? We want to recruit people through your organization. That is not the way to build a relationship, right? So if you know, I mean, I will say as a fellow, I knew I wanted to do research on adolescent diabetes prevention. So I started by presenting my ideas to an existing board that was already doing diabetes prevention research with adults. And me as a pediatrician, I wanted to expand that work to adolescents. So I got some people on board who were kind of engaged or excited about the idea of expanding that work. And then I actually went out and spoke to people in the community like, what do you think about this? Is this something that people are worried about with obesity rates skyrocketing? We're seeing more diabetes risk in kids and starting to have conversations really, and then just showing up at community board meetings or health coalition meetings and really just being there, you know, before there's any grant funding or any IRB protocol or anything, really having people get to know you and why the work that you're interested in doing is important and who really cares about this topic. And then once you start thinking about, oh, there might be a grant that we can apply to get some funding support for this, have those people come and say, okay, what is the grant that we should write? What is our research question? How are we going to collect the data? Who do we want to engage in this research? So I would just say, you know, go get to the table before there's a specific research agenda in mind, because that's forming those relationships early and then maintaining them is going to be really important for the longevity of your research. And then being able to go back to the people who are really friends and colleagues that you know and trust over many years when opportunities come along.
Absolutely. It's really important to engage with the community early on. And Crispin, um, like this next question is for you. How do we ensure, no, what does the process and the initial steps of onboarding advisory or action boards members look like?
So initially, it could look different depending on the type of engagement that you're doing and the type of board that you're creating. But I think what's really important is that before you start the onboarding process, as those who are working on creating this board, form a process and let it evolve, because often the first couple of people that join will have insight into how successful or what challenges or what could have been done better to help them be able to participate more. And so those who may come on, other members may come on later on in the process, they can be like a mentor to those coming in, right? And so Brenda Lee and I served on the patient engagement advisory panel, PCORI, way back when. And in that process, you had a mentor, and the mentor would meet with you and onboard you so that you knew what the next steps were. And if you had questions, you could ask and feel like you were connected to someone. So I think it's different for each group, but there definitely has to be a plan in which you're thinking about how you onboard people, because we can't expect that everybody's going to be at the same place and have the same experience and same knowledge coming in to joining a board.
Yeah, that's incredible. And in addition to just some of that process of onboarding and getting people into the flow of board meetings, I like what Getty had to say in the chat about just making sure that people know the ask. They know the specifics of the compensation, they know their responsibilities, the expectations, all of that is sort of outlined to them from the get-go. And Getty, I do see you have your hand up, but I have one more question for Brenda Lee before we get into our open Q&A. And so this last question for you, Brenda Lee, is just how do you ensure that advisory board members remain engaged and feel valued over time, right? We're talking about sustaining partnerships. We're talking about, as Neetha said, making these lifelong friends and colleagues and collaborators. How do we make sure that people feel valued and stay engaged?
Yes, that is a very important question about that meaningful engagement. What's the definition of meaningful and to whom, right? And it's a process, and definitely what we have seen being successful in the past is that there is an ongoing review of your activities about how you engage and maintain them, because as they are part of that process of taking the temperature and giving you feedback on the process, not only on the content expertise, but also about the way that the activities that are happening, the frequency, is it too intense or too burdensome? Let's recalibrate what we're asking and when do we ask it. That ongoing review will help the teams not only to gather the input, but also find the best way to integrate it along the way. And people then are more invested in seeing this they follow through till the end. Also, we do need to have a plan for that attrition, because life happens. And you may be very, very interested, but you know your availability is more limited and so forth. But you need to incorporate mechanisms to provide that opportunity for them to tell you, and you plan ahead for that. So it's not to inflict guilt or, but it's rather it's just be realistic in that planning and in that ongoing review and assessment. And there are qualitative and quantitative measures. So we always see that successful examples mix both. It's not like to fill out another survey on how satisfied you are with this 1 to 4 or 1 to 5, and that's it. That's kind of a very basic. We do want to kind of flesh out more about what are they gaining for their participation besides any financial compensation. Maybe for some members are they're looking for the opportunity to contribute and do presentations, but they need to be assisted and mentored and helped with and trained to be able to be part of the team that actually talks at conferences and travels. Others members, when I was an executive director of a small organization, I didn't have access anymore to the academic library at the university. So that was one of my tasks when joining as a member of an advisory board. It was like, okay, can you give me access to your library for the resources that are usually, you have to pay membership, very costly memberships for subscription. So it's really a conversation with different teams because some members may want to receive training that otherwise they won't be, it will be an out-of-pocket expense. So you look at your resources in academic settings, you have the CTSAs and other organisms within the academic environment that can provide, make agreements and arrangements for having those resources available. All that will impact how members see this as a beneficial and meaningful to them as well, not only to the research team.
That's really helpful. And I actually want to ask a question. I know Alyssa had to hop off, but I think this kind of plays into this idea of how we ensure people stay engaged and feel valued, even amidst some of the challenges and obstacles we might face. For example, challenges around compensation, particularly if there are in large systems such as ours, but this happens, we know, everywhere, where there are delays in processing payments. And I think, you know, Alyssa shared that at some points it feels uncomfortable to ask folks to participate because there are concerns about making sure that the compensation can come through in a timely fashion. But I think that that's like one example of a barrier. And I think that there are also other challenges, and how do we kind of work with our partners and keep them motivated to stay engaged when things get maybe a little bit bureaucratically sticky and tangled up in a large system. And anyone can take that question.
We have seen teams that include that compensation in the subs. in the subcontracts with the CBOs because they have less bureaucratic hurdles to pass. So that's kind of one way that, and also it empowers and makes stronger the relationship with that CBO or other organization that is a sub from the main contract or the main award, because then they're part of the process and they are right there. So it's not necessarily seen as a pass-through, but it's really empowering that group to work with those stakeholders that they know better and that they can bring expediency to the payment process.
Thank you so much, Brenda. And I know, Getty, you have your hand up if you want to go next. Unmute yourself.
Oh, yeah. Okay, great. Hi, everybody. It's great to hear all the wonderful information from all of these folks that have done this work for so long. I think that the most important thing is to be honest and open, you know, in terms of the compensation, to say we don't know exactly what it, you know, just keep people informed and do the best you can to get them their compensation on a timely basis, but just so they know, you know, just keep sharing information with them. It's very difficult for us to get the payment, you know, but hang in there because you're gonna get it, you know. I remember once, like, we were able to get the payment for Christmas and everybody was so excited, right, that they had this little extra money coming in. I think everything, Nita, Crispin, and Brittany, that you've shared, you know, about how to get people engaged and involved is so, like, on point. I think to find community members that really care about their community from people that have existing relationships. I started doing some of this community engaged work because I already had existing relationships. And so the researchers, like my mentor, which is a really key thing, you know, for new researchers, find yourself a mentor that has been doing this or that has the community relationships already. You know, my mentor introduced me to Dr. Horowitz, and, you know, that just was such an important step for me in my life. And I knew nothing about research, and I learned from her, from Dr. Horowitz, from Barbara Brenner, who, like, made the connection and already had extensive community relationships, right? So if you're new, find someone that has done it and that will take you under their wing and help you to learn, you know. And also, you know, like Crispin said, have the new members have mentors that are already on the board that can sort of guide them and help them to become integrated. But I think the real key is to help people feel how important they really are, and, you know, how much they mean to the study, and how much you're valuing them and what they have to offer, you know, the project. So that's all I wanted to share. But thank you for all your insights, everyone.
That's amazing, Getty. And yes, oh my gosh, I feel like some of our community partners are on this call, and the amount of times that they have heard me say, like, I promise you will get, you will get paid, but it takes sometimes a little bit longer, and we have to follow up. But I think that piece of just being open and honest and communicative, and also relying on our networks to expand our networks, is such a valuable lesson. So I appreciate that. I have a question from one of our community partners that I'll ask. Chris from Riseboro is just wondering how successful nonprofits have been in finding grants that actually explicitly allow for board members to get compensated. And I think all of you can speak to that. So go ahead.
So I'll take the initial piece of this. So I think it really depends, and I don't know how we determine success and how we gauge success, but I will say that there's definitely avenues now more than ever to have these pieces included when you're talking about forming advisory boards, more than there were 20 years ago when I started this work. So I think it's really important to see the trajectory over time. And don't get me wrong, by no means are where we like to be in the optimal place, but we're moving in that direction. So I think that's really important. And Anita, to your point in the chat, it is. So like Brenda Lee mentioned, the foundational expectations for PCORI, not only that, but making you have to have an engagement plan, right? You have to be explicitly saying, how are you going to engage with these people, with these groups? What are the expectations? What are the roles and responsibilities? And there's a budget item for it, right? And so I think that's really important. And so there's not like, I would say we're more successful now than we have been in the past. And there's more opportunity now, but I'm not sure how to gauge success.
Yes, and if I may follow your comment here and address one of the questions regarding, okay, there are certain types of funding mechanisms that either for research studies that include a planning year or a feasibility phase, and that is full-on engagement. It's allowing, because now more and more they realize that it's needed, and recording as an example, we have some funding mechanisms that have that as integral part of the research. Now, there are other types, especially with the CBOs and other organizations that are less attuned with the research component yet, but they want to get there. And there is a funding announcement that is called the Eugene Engagement Awards, and I put the link in the chat. So those engagement awards are for individual organizations, never to an individual, but to an organization that is getting ready for that contribution in research. So they, just to gather the stakeholders together, there's one type of engagement award. Another type of engagement award is for capacity building, and once you bring them together, develop activities and product toolkit training that will increase their capacity to be ready for that, be a partner in a full research award later on. And also there's a third type of engagement award that is for disseminating what others have already studied and done. And we don't want those results just to be in a JAMA or an academic article. We want to see that implemented and get into the hands of patients and caregivers that need this information. So you can polish your chops and submit for an engagement award to disseminate. So in that way, you also develop a relationship with the funder, and that will put yourself and your organization and your stakeholders in a better position. So when you submit a full research award in the future.
To that, Brenda Lee, because you're from PCORI and we're talking about expectations from funders, I'm going to go to a question that we have from Dr. Nihal Mohammed, which is, what are PCORI's expectations regarding the commitment and responsibilities of a patient or stakeholder serving as an MPI or co-investigator, particularly in terms of their involvement in the research and oversight of the study? And if you could provide an example, that would be great.
Certainly. Well, as we got created in 2010, and since then reauthorized in 2019, we have accrued a body of evidence that really speaks about a continuum of engagement in which we're building up to create better funding announcements. So from the very basic, and we have, I didn't include it here for brevity, but we have like that traditional model of just that is the minimal, like the basics of just asking for input. That's, with a survey or something, all the way to more involved. And the opposite end of that continuum is that collaboration aspect, in which is co-creating, and the engagement has the ultimate for us as of now, that the PI, the co-PI or dual PI structure is from a patient or a representative from a patient advocacy organization, or even a local government representative, because that intervention is going to be included in the work to be done. So you can see in that foundational expectations link that I post there more and elaborate more, but definitely we do as a funder now have a specific examples of partners, the funding announcement partner that was on maternal health, and we have placers, the large multi-phase clinical studies that do include and request a more elaborate structure that includes either a dual PI or co-PI for members of those advisory stakeholders that are so important for that study to be ultimately successful.
I would just like to chime in really quickly on this point because I think it's really important. Clearly, PCORI is like ahead of the curve here. This is what PCORI does, and so there's a lot of built-in infrastructure, I think, to support mechanisms like dual and co-PIs. I would encourage anybody who's applying to any funding, whether that be NIH or a foundation, to speak to the program officers and the funders about your interest in having a community co-PI or MPI, because sometimes the expectations around being part of the investigator team, having to submit like an NIH style biosketch and all of those things are not community friendly. So I think really leading on this as researchers and sort of educating funders that if you want more community people to be in leadership on projects, then we have to be flexible in what and how we show their expertise, right? It might not be, I've gotten these grants and published these papers. There may be other ways to kind of justify a PI role for somebody based on their lived experience and other things. And so I think just really being open and an advocate when talking to funders about ways that their applications can be sort of modified to accommodate all types of expertise as part of leadership and research.
We have time for one more question if anyone has one and wants to raise their hand and come off mute or type it in the chat. I see Timnit putting in our feedback form.
While we're waiting, I did want to also just, I think over the years, I've been involved with putting together lots of different boards for lots of different projects. And so I think one of the important things is to really understand why. Why are we trying to pull this group together? And that will really help inform the next steps, right? So like I mentioned the adolescent diabetes prevention work. In that case, we started with more like adult stakeholders, and then organically it involved more young people as sort of being part of that board. In another project, I was trying, we're trying to figure out ways to get patient and caregiver perspectives on child health research at Mount Sinai. So there I started by doing a needs assessment among research faculty to see what types of support they need for their research. And then that helped inform how we recruited board members. In another case, we were looking at impacts of sort of segregation of care based on insurance status in quality of care in ambulatory practices. So there, when we were putting a board together, we wanted to make sure we got representatives from doctors, nurses, medical assistants, front desk staff, patients, caregivers, etc. So I think depending on what the ask is and the goals are of the project, that'll help you identify who needs to be at the table, who needs to be part of the board, and then you can kind of go from there.
And Neeta, to piggyback, I think that's really important. The who, the why, all of those things to make sure that you're really being responsive. You don't want to create something just to create it and not have a need, right? And so there's some other projects where we're working on structural racism and kidney disease, and we're working with community health workers. We realize that community health workers can give us some important insight into what we need to understand, and not only have some patients been hired as community health workers, they're part of our board. And so understanding their lived experience is way different than what we expected and so needed.
And to close that loop, Kristen, when you are putting together your engagement plan at the beginning with your proposal at the beginning of the project, it's a living document. So along the way, you find out holes, you find out better ways, or who else needs to be at the table at the beginning we didn't think of, or there is an opportunity, and then you revise and recalibrate those, and that's part of what we ask with these, an updated engagement plan 6 months into this, because we recognize that changes are bound to happen, and especially that puts you in a better position to implement any changes in the future.
Incredible. Well, on that note, thank you all for sharing what you've learned along the way. Thank you all for asking questions and joining us. Timnit has her hand up. No, she does not. She's been putting a few things in the chat for you all to respond to, including our brief feedback form. There's also the flyer for our next seminar series, our next seminar series session, which will be on exploring positionality in community engaged researcher, looking at insider positionality and outsider positionality. And that will be, I think it's May 21st, not March 21st. Right, Timnit?
It's May, yeah.
Okay. So we will see you in the spring, but thank you to the three of you so much for all of this insight and for all of the great work you do.
Thank you for the invite. Thanks, everybody.
Thank you.
Thanks all.